Good morning, good morning, good morning! Breast checks. All women over the age of 20 should examine their breast once a month. The ideal time is a few days after your period ends, as your breasts are not then swollen or tender as they may be before and during your period. Postmenopausally, do your breast examination on a fixed date every month. Stand in front of a mirror and check your breast visually with your arms in three different positions: by your sides, raise above your head, press the palms of your hands against each other to flex the pectoral muscles under your breast. With elbows out and hands pressed firmly on your hips. Can you see any sign of misshaping or unusual contours? Do they look any different from last month? Is there any discharge from around the nipples? Is there any skin rash or eczema around the nipples? Next, palpate each breast in turn. This means gently but firmly prodding your breast with the flat of your fingertips. You may find this easier to do lying down, especially if you have large breasts. Use the left hand for the right breast and vice versa, and work in concentric circles, starting from the outside and ending up near the nipple. Press the nipples gently to see if there is any discharge. What you are feeling for is any lump that has not been there before. Finish by checking for any small, firm lumps in your armpit or up towards your neck. You have a concentration of lymph nodes here that can be affected by tumorous growth. If you see or feel anything unusual or different, go and see your GP without delay. You will probably discover that a lump is benign. You will probably discover that a lump is benign, but the earlier the detection of anything malignant, the better the chances of successful treatment. Tenderness. Breast can become tender for a number of reasons. A young girl's growing breasts are naturally sensitive as they develop, and many women find their breasts become more tender in the premenstrual phase each month. This is because the glandular cells enlarge and the ducts widen, causing the breast size and firmness to increase, just as it does during pregnancy. These symptoms of premenstrual syndrome is nothing to worry about, but can be a problem when even the slightest touch by underclothing or movement causes pain and your sleep is interrupted. Women with hardened breast tissue find that hormonal swelling of the breast due to the action of progesterone makes them tender. Sometimes the pain is very localized, usually at the site of the hardening. For alleviating painful tenderness, see treatment under fibrocystic change. Nipple discharge. A discharge from the nipple is surrounding areola. can be either milky or watery. Any discharge should be investigated, but a milky discharge is usually due to overproduction of the hormone prolactin, which stimulates milk production. Certain drugs and contraceptive pills can sometimes cause this. It is usually more prominent before a period of it is usually more prominent before a period and disappears once the period begins. Treatment. The following can all help exist milk production. Going on a low protein diet for a couple of months. Neck and shoulder massage to improve pituitary function. Prolactin stimulation comes from the pituitary. Vigorous exercise. A soothing poultice. A hot salt poultice can help relieve all forms of breast tenderness. Heat salt in a pan and pour into a handkerchief or square of cloth. Wrap this in a second cloth if the poultice is too hot to bear. Apply it to warm the area that hurts. Supplements. Zinc, 15 milligrams in tablets for a couple of months, is helpful in hormone regulation. There are also homeopathic remedies that can help to regulate milky secretion. Consult a qualified homeopath. That ends our breast check, tenderness, and nipple discharge. God bless. Bye bye.